So hello everyone, I'm Janet DeMille, Medical Officer of Health of the Thunder Bay District Health Unit, and this is welcome to our second of our weekly Q&A sessions with myself as the Medical Officer of Health. So Steve's going to give me some questions and I'll move on and answer them.
Right on. All right, your first question. The WHO has warned against shutting down immunizations of childhood diseases during this pandemic. So is this a concern that you also have? And are we going to see the immunization clinics open soon, and how will this be done safely?
Yeah, so that's a great question, and certainly something that has been on my mind and the minds of my colleagues, whether provincially or nationally. So immunization programming is a very important part of what we do in public health, and we do that in collaboration with our healthcare providers, family physicians, nurse practitioners, and others in the community. And a lot of that has been put on hold because of the COVID. So the last couple of months and needing to respond to the COVID. And of course, the fact that a lot of visits to healthcare providers have moved into the virtual realm where you can't provide an immunization. So it's quite possible that there are many people, including infants and children, who have not received their immunizations that they would have otherwise received at this time. And that does put us as individuals or as a community at greater risk of seeing some of these infectious diseases, which we call vaccine preventable diseases, come back either in cases or even clusters, or even worse in an outbreak situation. But likely right now we're not necessarily at increased risk of that, because all the social distancing, the physical distancing that we've been doing has likely reduced the transmission of any of those at the present time. However, as we look forward, we really need, as public health and as healthcare providers, to be looking at how to ramp up or resume some immunization services. So I think the question, there was a specific note about infant and children, the immunization of children, which is a really key one, because there's a number of immunizations that children and infants need to get. And so what we're already doing internally here at the Thunder Bay District Health Unit is looking at how we can provide immunization services again. Maybe not in quite the same way we were doing it before, where we used to have an immunization clinic, for example. We wouldn't be doing that kind of model at the present time, because that wouldn't necessarily support physical distancing. As well, we're not going into schools right now, which is another place we've always delivered immunization, especially for youth and young adults. So we've already started those conversations. We're looking at how to be able to ensure that people who really need it are receiving their immunizations, including for infants and children. Looking at alternative models of being able to do that, and of course working with the primary care providers that we've always worked with to support them in also delivering those immunizations and in catching people up who may have missed that. So stay tuned for more information on that about from us.
Great. The next question asks, what's the best way to keep family members who are immunocompromised or have pre-existing conditions that make them more likely to experience critical illness from COVID-19 safe? And the second part is, should they, the compromised loved ones, should they stay isolating alone? Or are there ways to keep them safe while still living together?
Right. So we know, of course, that COVID can impact anybody of any age and any health status. But we certainly know that there are three groups that are at higher risk of having more severe illness as a result of COVID. And those individuals may need hospitalization. So it's quite significant in those potentially for those individuals. So that includes anybody in their 60s and older are at higher risk. Individuals of any age who have underlying health problems, for example, problems with their lungs or their heart, their liver or kidneys, or diabetes as examples. And certainly anyone of any age whose immune system may be compromised. And that could be compromised because of underlying health problems. Cancer, for example, can compromise the immune system, as well as individuals who may be on medications that are what we call immunosuppressive. So they may impact the immune system as well. That puts those individuals at greater risk of COVID complications. So what we do recommend is certainly those individuals should be isolating at home, not going out of the house for non-essential reasons, It is important, they don't have to isolate within the house from other people for the most part, but they should try as much as possible to maintain that physical distancing of at least 2 meters between people. And certainly if there was somebody else in the house who was sick in any way, sort of who had respiratory symptoms, we would actually recommend that they do not, that they sort of isolate, or that there's even greater distance between those people, somebody who is ill and an individual who may be more vulnerable. If somebody has to provide care to an individual, like who has underlying medical problems, we would certainly encourage a mask being used and that individual to wash their hands both before and after that interaction. And certainly observe all of those other precautions in general, the hand washing, the coughing in the sleeve, and cleaning environmental surfaces, cleaning and disinfecting environmental surfaces, all really have particular importance in those households. Ideally, if there was a separate bedroom that person could use, who may be more vulnerable, a separate bathroom, if that can't happen, then we would certainly recommend that individual use separate towels, just so that there's no cross-contamination, for example, reducing that exposure. Now, it's important we would want individuals to take care of their mental and emotional well-being as well. So it's okay to go outside. It's okay to spend time outside, such as in the backyard. It's okay to go outside to get some exercise. We would recommend, though, going at off-peak hours, and avoiding any interactions outside with other people. So if a lot of people in the neighborhood are going out for a walk, that may be not a good time for somebody who's more vulnerable, because they might come potentially within 2 meters of somebody else, for example. And certainly maintaining connections in other ways that don't require physical proximity. So reaching out to have social interactions through other electronic means, for example, would be important. And if an individual does have to go to visit a healthcare provider, or even go to the hospital if they need to go, we would not recommend using public transportation or ride shares or taxis, for example. If they can drive themselves, that would be okay, or going with a family member, one person being maybe the driver and the other person in the back of the car, to try to maintain that physical distance in those cases as well. So.
Okay, great, thanks. This next question we receive a lot of on social media. The question says, why aren't you saying which community the cases are from? And how will I know if my community is safe?
Okay, so we do get that question a lot. So one of the biggest reasons why we don't give that level of detail about our cases is for confidentiality and privacy purposes, and to try to avoid stigmatizing those individuals. So, and we do give some information. So in our cases, it's Thunder Bay and surrounding areas, district communities or First Nations communities, but we don't go to the level of specifying which community that individual is in, or that family or individuals are. Unfortunately, what we've seen in the cases, in some of the cases that we've had here in the Thunder Bay District Health Unit, is that people have experienced, people have had negative experiences, and that's all over, even in Thunder Bay, but because sometimes their neighbor or their community finds out that they're positive, and it's through other routes. And that's been really challenging for some of the individuals that we've worked with who've had COVID. And sometimes these are individuals who really unknowingly and unintentionally got COVID. They didn't, nobody purposely obviously goes out and gets COVID and brings it back to their community. And so they're in a really unfortunate situation. And when they've had to deal potentially with their neighbors or others, having, reacting to that or making comments on social media. I think that that's been particularly challenging. And I think that overall has had the risk of maybe people not wanting to come forward or not wanting to be tested because they're fearful of getting that kind of reaction. So I think as communities, as neighborhoods, as communities, we really need to be mindful of that, especially if we want to, as we go through the next phases of this pandemic, where we sort of want to normalize, that we want to have that new normal as it comes to dealing with COVID, and supporting individuals to stay at home, and being mindful of that and the consequences of that. When we talk about the safety of communities, we are experiencing this pandemic here. We've obviously had cases, we're up to 76 right now that we've had here, although most of them are resolved. And we're going to experience more cases. So every community is at risk, unfortunately. Every person in those communities is at risk because we know the pandemic, we know the virus is here. So whether you've actually had a case in your community, we need to all act like the virus is in all the communities. We need to be mindful and not get complacent about all of those measures we all need to do and we need to take to reduce the transmission in our communities, regardless of whether there's actually been a case identified in those communities. So yeah, I mean, I'll leave it at that and hope that I've answered that question.
Yeah, definitely. It's a sticky question. The last question asks, I can understand why communities north of Toronto don't want an influx of people into their communities, especially with Toronto being so hard hit by COVID-19. However, in the Northwest, many of our camps are close to home, and we neighbors are spread out so we can keep our distance. So the question is, why is the health unit still recommending that we stay away?
Right. So we're recommending right now not going to camps or cottages, or even more broadly, it has been our recommendation to avoid any non-essential trips outside of your home community. And often, going to your camp requires you to go to another community or another area. So that's our current recommendations. Now we know in terms of camps and cottages, and especially as the weather gets nicer, people want to go to their camps and cottages, and that's been really a hot topic of discussion. In many ways this week, I've heard it with even the Premier making some comments about that. And it's possible that we'll hear fairly soon about that in the way we've heard about other things opening up. So I think, it's currently our recommendation to not go to camps and cottages, but of course we're monitoring what's happening and what direction we're getting at the provincial level, and we'll be changing, or updating our recommendations as we move forward. I think whether these things are changed provincially or not, and for people who choose to go to their camps or cottages anyway, we would still advise you to do that cautiously. So a couple of things to think about if you do choose to go, or consider doing, getting your groceries before you leave your home community, to where you usually get your groceries. Get your gas for your car, get the things that you need in your home community, so that when you travel, you don't need to necessarily go to those smaller stores or those smaller facilities where you might need to go. Just go with your immediate family, and don't hang out with people that are coming from other areas or that are outside your immediate family. If you're at your camp or cottage, those same measures apply, right? You could hang out with your family members, the people that you live with in your home community. Just stick with them in the camp. So just be mindful of all of those things if you look to traveling, and certainly more if the province does decide to permit or be less restrictive about that kind of travel. We do anticipate that there will be guidance coming down or direction coming down from the province that we will, of course, put out on our usual communication channels. But we just encourage you to abide by all of those as well.
Great. Well, thanks very much. That was the last question for this
Okay.
week. So thanks a lot, Dr. DeMille. And
Okay.
I guess we'll resume this conversation next week.
Right, and don't forget the email.
That's right. We'll put that on the screen as well. Thanks.
Okay, thank you very much.